It's Respiratory Care Week, and here now from Parkland College Respiratory Care Program, we have registered respiratory therapists Midge Seam and Amanda Harris. Welcome to both of you. Let's talk a little bit about what a respiratory therapist job is.
A respiratory therapist is an allied health professional who will take care of patients who have problems breathing. Sometimes it's an acute problem like a pneumonia or a chest wall injury from an automobile accident or some other traumatic event. Other times it's going to be the chronic diseases, the asthma, the COPD, the emphysema, the lung conditions that are associated with environments like pulmonary fibrosis for people who work in paint shops or woodworking that's unprotected. And so we get to see a variety of patients everywhere from the baby born too soon who doesn't come with alveoli yet that are fully functional to the people who are very old. And we save some lives. Those acute illnesses, we can save some lives. And for those people who have chronic illnesses, we can help to make the time they have left better.
Very good. And Amanda, you've got some tools that maybe some of these examples that Midge was sharing could use to benefit them. So what do we have here?
Okay, so this is your MDI inhaler. It's a meter-dose inhaler. And many people at home do not use a spacer, or they've not been told. So we thought we could give some general education on how to use one of these.
Okay, I'm going to stop you right there because my son and myself actually have an albuterol inhaler, and we've used those before. But I didn't know it came with an attachment. How do you get that? Because that usually doesn't come in the little white pharmacy bag when you check out.
I think your doctor can actually prescribe you one, or I've seen them in a couple of pharmacies at your local, pharmacy.
Why do you want one of those?
Well, sometimes it's just hard to squeeze this down and take a breath. If you breathe too fast, it's all going to hit the back of your throat. It's not going to get into your lower airways to actually do its job. So this device is just to help.
Okay, so how does it work?
Alrighty, so first off, when you use an MDI, if it's the very first time you've done it, you must prime it. So you're going to want to shake it, and then that way you get a nice good puff instead of what you've seen for that first one. So you're going to take the cap off that, you're going to take the cap off this. You insert the inhaler into here. So what you do when you press the button there, it's going to fill the medication and hold it. It does not stick to it. It has a coating on it that keeps it from doing that. And then you want to breathe through this slowly and deeply. It will actually whistle if you're breathing too fast. Again, if you're breathing in the medication too fast, it's going to get on your throat and in your mouth. You are not going to get it into your lungs. So you give it a shake, wrap your lips around this.
Oh, and it's as simple as that. Oh, she's counting. Okay.
They say to hold the medication in for about a count to 10, and then you wait 30 to 60 seconds, and you'd want to do the second dose. Usually you're given you're given 2 doses. Sometimes it can be up to 6 or 8, just depending on what the doctor's ordered.
Oh, wow. Okay. Well, that's a handy little tool. We won't make you take 2 doses here right now. We'll let you do good with just 1 puff there.
Okay.
Let's talk about the program at Parkland, though, because this is kind of a field that has some openings for people.
There are an amazing number of openings, excellent job opportunities. Parkland offers a 5-semester program. It's an associate degree program. That's the entry-level requirement to begin practice as a respiratory therapist, is to have that associate's. The program at Parkland, just 5 semesters, pretty intense. There are some general education requirements for English, some sciences, a psych course, and then the respiratory therapy curriculum. In that 5 semesters, you've got some classroom time, some lab time, and some clinical time in our local and area hospitals where you actually work side by side with a therapist and learn to actually do the things a therapist would do.
Very good, just like Amanda did there with teaching us how to do that. But I'm sure it's a little more entailed there. The 15th best job in healthcare. Who knew? A best kept little secret.
It is wonderful.
Okay, and we've got a great program right here at Parkland College for you to learn more. Apparently you can make up to like $70,000. So hey, how about that? Sounds like a great career to consider if you are looking to get into healthcare. Thank you so much for coming. This has been very informative. If you want to learn more about the respiratory care program there at Parkland College, there's a look at their website. We, of course, will post that at CILiving.tv, and we wish you a happy Respiratory Care Week.